Have you ever felt that quiet uneasiness when you hear the words silent infection and wonder what they truly mean for you? One of my patients once shared that the hardest part was not feeling sick, but not knowing whether something could be happening beneath the surface. I want you to imagine this for a moment. You are sitting in a familiar place, breathing calmly, looking for understanding that brings reassurance rather than worry. I am Dr. Evelyn Carter, and for many years I have had the privilege of caring for older adults who value clarity, routine, and emotional safety. When topics like Nipah virus and silent infection appear in health conversations, they can sound unsettling at first. That is completely understandable. We often associate illness with obvious signs, so the idea of something being quiet or hidden can feel unsettling. But learning about this topic is not about creating fear. It is about restoring confidence and helping you feel grounded. From my experience, what troubles seniors most is not illness itself, but uncertainty. Silent infections feel uncomfortable because they seem invisible. In simple terms, a silent infection means that the body may not show clear signs right away. This can happen with certain viruses, especially in older adults, whose bodies respond differently than they did years ago. That difference does not automatically mean danger. It means the body is processing things in its own careful way. Medicine understands this. Aging bodies often send quieter signals, and doctors are trained to look beyond obvious symptoms. When we understand that, the mind relaxes. When the mind relaxes, the body follows. Memory feels steadier. Sleep comes more easily. The heart finds a calmer rhythm. Understanding replaces fear, and calm becomes part of care. In the next part, I will gently explain what silent infection truly means and why it does not require you to change your daily life or routines. If you find this conversation helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. This channel is here to offer steady guidance, clear explanations, and a place you can return to whenever health information feels overwhelming. When we talk about a silent infection, I want to begin by taking the mystery out of the word silent. In everyday language, it simply means that the body does not announce what is happening in obvious ways. There may be no fever, no pain, no clear signal that something needs attention right away. For many older adults, this idea can feel unsettling because we were taught to trust symptoms as our guide. I remember a patient who once told me she felt uneasy because she did not feel sick, yet a routine check showed something her body had been quietly managing. Her first question was not about danger, it was about trust. She wondered if her body had failed her. What I explained then, and what I want to share with you now, is that silence does not mean harm. Often, it means balance. As we age, the body learns to respond differently. The immune system becomes more measured. It does not always react loudly or quickly. Instead, it may handle changes in a quieter, slower way. This can be especially true with certain viruses. A silent infection means the body is working behind the scenes, sometimes successfully, without disrupting daily life. In my caregiving experience, I have seen many older adults carry infections that never caused distress because the body kept things in check. These individuals continued their routines, slept well, and felt steady. The absence of symptoms did not mean something was being ignored. It meant the body was coping in its own careful way. This is why doctors do not rely on symptoms alone, especially with seniors. We look at patterns, history, and overall well-being. We listen to how someone feels emotionally as much as physically. Silent infections remind us that health is not only about what we feel, but also about how the body adapts over time. It is important to understand that silent does not mean invisible to medicine. Healthcare systems are built to notice changes, even when the body is quiet. Routine monitoring and thoughtful observation help doctors understand what is happening without rushing to conclusions. For older adults, this understanding brings reassurance. You are not expected to sense every internal change. Your role is not to worry or search for signs. Your role is to live within your routine, notice how you feel overall, and trust that your body and medical care are working together. When we see silent infection through this lens, it becomes less frightening. It becomes a reminder of the body's resilience and wisdom. Quiet does not always mean something is wrong. Sometimes it means things are being handled gently, steadily, and with care. When people hear the name Nipah virus, it can sound unfamiliar, and that unfamiliarity often creates concern. What is important to understand is that this virus can remain unnoticed early, not because it is aggressive or constantly present, but because it is rare and appears under very specific circumstances. Rarity changes how medicine encounters and understands an illness. In my years of practice, I have learned that timing matters just as much as symptoms. Some viruses move through communities regularly, which gives doctors many chances to recognize patterns quickly. Nipah virus does not behave that way. It appears infrequently, sometimes years apart, and often in limited settings. Because of this, early signs may not stand out against the background of everyday health changes that come with aging. Older adults often experience subtle shifts in energy, sleep, or appetite that are part of normal life. When a rare virus does not cause sudden or dramatic symptoms, it can blend into those familiar changes. This does not mean something dangerous is happening. It means the body is responding quietly and the timing does not draw immediate attention. I often remind patients that medicine does not label something concerning simply because it is quiet. Doctors look at how often an illness appears, how it behaves over time, and whether it disrupts daily functioning. With Nipah virus, the early phase may pass without noticeable disruption. That early quiet period is one reason it can go unnoticed, not because it is spreading widely, but because it is not common. Another important factor is that the body's response can vary with age. An older immune system may react more gently, without the strong signals we associate with illness. This gentler response can be protective. It allows the body to maintain balance and avoid unnecessary strain. From an emotional perspective, understanding rarity helps reduce worry. Rare does not mean imminent, it means uncommon. For seniors, this distinction is vital. Living with constant alertness is far more harmful than living with informed calm. Timing also plays a role in how medicine observes Nipah virus. Because it appears sporadically, researchers collect information slowly and carefully. This deliberate pace ensures accuracy and protects people from unnecessary interventions. When you hear that Nipah virus can remain unnoticed early, it is not a warning meant to alarm you. It is an explanation of how uncommon events are recognized in medicine. Your role is not to watch for rare illnesses. Your role is to maintain your routine, notice how you feel overall, and trust that medical systems are quietly attentive. This understanding allows the mind to settle. It reminds you that healthcare is not built on fear, but on observation, patience, and respect for the body's natural rhythms. In medical care, especially with older adults, doctors learn very early that symptoms tell only part of the story. Many important changes in health do not arrive with clear signals. That is why detection often relies on careful monitoring, attentive listening, and steady observation over time, rather than on dramatic signs. When I sit with a patient, I listen to more than words. I notice posture, breathing, energy, and the way someone describes their days. Small details matter. A change in sleep quality, a shift in appetite, or a new sense of fatigue can offer more information than a single symptom. For seniors, these gentle signals are often the body's way of communicating without creating distress. Monitoring is not about constant testing, it is about consistency. Regular check-ins, routine measurements, and familiar patterns allow doctors to notice when something changes. This approach respects the aging body, which benefits from stability rather than frequent disruption. Over time, these quiet observations create a clear picture of health. Listening is equally important. Older adults know their bodies well. When someone says they feel different, even if they cannot name a symptom, that information is valuable. In dementia care, listening becomes even more essential. Changes in mood, engagement, or routine can signal physical issues long before symptoms appear. Doctors are trained to take these cues seriously. Observation requires patience. Health does not always change quickly, and rushing to conclusions can cause unnecessary stress. By watching how the body responds over days or weeks, doctors can distinguish between normal variation and something that needs attention. This careful pace protects emotional safety and preserves trust. I often explain to families that detection is like watching a familiar landscape. When you see it every day, you notice subtle shifts that others might miss. That is how doctors work with patients they know well. Patterns become clear without alarm. For older adults, this approach offers reassurance. You are not expected to recognize every internal change. Your role is to live your life, maintain your routine, and share how you feel honestly. Medical care works best when it supports you quietly in the background. Understanding how doctors detect illness beyond symptoms helps replace fear with confidence. It shows that silence does not mean neglect. It means careful attention is already in place, guided by experience, patience, and respect for the body's natural rhythms. When we connect the idea of silent infection to senior health, especially dementia care, one truth becomes very clear. The aging brain needs space and time to feel safe. Too much information delivered too quickly can overwhelm the mind, even when the information itself is not alarming. I have seen this many times in caregiving settings, and it is an important part of this conversation. As the brain ages, it becomes more sensitive to speed and volume. Rapid updates, changing messages, and constant exposure to health news can create confusion and anxiety. This is especially true for individuals living with memory changes. When the brain feels rushed, it struggles to organize thoughts and emotions. That struggle can appear as restlessness, withdrawal, or increased forgetfulness. Silent infection fits into this picture because it challenges our expectations. We are used to thinking that illness announces itself clearly. When it does not, the mind may try to fill in the gaps. If too much information arrives at once, the brain can become overloaded, leading to worry rather than understanding. In dementia, Carrie, we work carefully to avoid this overload because we know it can worsen confusion and distress. Routine plays a protective role here. Familiar schedules, trusted voices, and repeated explanations help the brain stay oriented. When information is introduced slowly and calmly, it can be absorbed without disrupting emotional balance. This is why gentle communication is just as important as medical accuracy for older adults. In my practice, I encourage families to focus on consistency. Rather than chasing every new update, it is healthier to return to what feels familiar. Meals at regular times, steady sleep, and predictable days give the brain a sense of control. That sense of control supports memory and reduces anxiety. Doctors understand this need for pacing. That is why monitoring and observation often happen quietly in the background. Medical care does not need to be loud to be effective. For seniors, quiet care is often the most supportive kind. Understanding silent infection within the context of senior health helps us shift our focus. The goal is not to gather more information faster. The goal is to protect emotional safety and dignity. When the brain feels safe, it functions more smoothly. When it functions more smoothly, the body follows. This is how patience and thoughtful care support well-being in later life. As we grow older, the body becomes wiser in many ways, but it also communicates differently. This is especially true when it comes to early signs of infection. In older adults, those signs may be subtle, quiet, or even easy to overlook, not because something is wrong, but because the immune system has changed with time. In younger years, the immune response is often loud. Fever rises quickly, discomfort is clear, and the body sends strong signals that something needs attention. With age, the immune system tends to respond more gently. It conserves energy and avoids overreaction. This calmer response can be protective, but it also means early signs of infection may not stand out. I have cared for many seniors who expected illness to feel dramatic, only to be surprised when it was not. Instead of clear symptoms, there might be a slight change in energy, a quieter appetite, or a feeling of being a little off. These are not alarms, they are soft signals, and they reflect how an aging body prioritizes balance. Gentle science helps explain this. Over time, immune cells respond more slowly, and inflammation is often reduced. This can lower the intensity of symptoms like fever or pain. The body is not ignoring the issue. It is responding in a measured way that protects overall stability. For older adults, avoiding excessive strain can be beneficial. This is why doctors do not rely on dramatic symptoms alone when caring for seniors. We look at trends rather than moments. How has sleep been over the past week? Has daily routine changed? Is there a new pattern of fatigue or confusion? These observations are often more meaningful than a single symptom. In dementia care, this approach is especially important. A small change in behavior or engagement can be the earliest sign that the body is responding to something. That is why calm observation and familiarity are so valuable. They allow subtle changes to be noticed without causing distress. Understanding that early signs may be quiet helps ease worry. It removes the pressure to constantly search for symptoms. You are not expected to monitor your body closely or feel anxious about what you cannot see. Medical care is designed to notice patterns gently and respond thoughtfully. For seniors, this knowledge restores confidence. It reminds you that your body is not failing you. It is adapting. Subtle signs are part of that adaptation. When we respect the slower, gentler language of the aging immune system, we support both physical health and emotional peace. As we pause here together, I want to acknowledge something important. Choosing to learn about your health in a calm and steady way is an act of care for both your body and your mind. Many older adults tell me they feel worn down by fast-moving information and urgent messages. That constant pressure can quietly drain energy and confidence. Slowing down allows understanding to settle without stress. In my years of caregiving, I have seen how clarity brings relief. When seniors understand what matters and what does not require immediate concern, their days feel lighter. Sleep becomes more restful. Breathing feels easier. Routines regain their comforting rhythm. This is why I believe health education should feel like a conversation rather than a warning. Senior Health Daily was created with this purpose in mind. It is meant to be a familiar place where information is offered gently and respectfully. You are not expected to remember everything at once or to act quickly. Understanding grows gradually, and that pace supports dignity and emotional safety. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Staying connected to a steady source of guidance can make a meaningful difference. When information comes from a place of care and patience, it becomes easier to trust. Trust reduces worry, and reduced worry supports memory, heart health, and overall well-being. This is especially important as we age, when emotional balance plays a central role in physical health. I often remind my patients that you are not meant to carry health concerns alone. Reliable information and supportive voices exist, so that you can focus on living your life with comfort and confidence. Sharing this space with others who value calm understanding creates a sense of community that strengthens resilience. If you found reassurance here, that reassurance can be passed along. Sharing gentle knowledge with someone you care about can help them feel less alone as well. Health education does not need to be loud to be effective. Quiet understanding often has the greatest impact. As we continue, remember that your body responds best when the mind feels safe. Choosing patience, familiar routines, and trusted guidance allows both to work together smoothly. That harmony is a powerful form of care, and it is something you deserve at every stage of life. When the topic of prevention comes up, many older adults instinctively wonder what they should change. Should daily habits shift? Should routines be adjusted? Should life become more cautious? I want to gently reassure you that prevention, especially in this context, is not about disruption. It is about stability. For most seniors, continuing your familiar routines is one of the strongest forms of protection. Regular sleep, consistent meals, gentle movement, and time spent in places that feel safe all support the immune system in quiet but meaningful ways. The body responds best when it knows what to expect. Sudden changes, even when well-intentioned, can create stress that does more harm than good. In my caregiving experience, I have noticed that older adults who maintain steady routines tend to feel more confident and grounded. Their days have a rhythm that supports both emotional balance and physical resilience. This steadiness allows the immune system to work without unnecessary strain. Prevention begins there, not with constant vigilance or worry. It is also important to remember that healthcare does not rely on individuals alone. Medical systems are designed to monitor health concerns carefully and continuously. Public health professionals, doctors, and researchers work quietly in the background, observing patterns and preparing responses long before action is required. This allows daily life to continue without interruption or alarm. Trust plays a vital role in prevention. When you trust that healthcare systems are doing their work, the mind can relax. That relaxation supports memory, sleep, and heart health. Constant alertness does the opposite. It keeps the nervous system activated and drains energy that the body could use to maintain balance. Prevention also includes protecting emotional well-being. Choosing reliable sources of information and limiting exposure to alarming messages helps preserve calm. You do not need to follow every update or interpret every headline. Staying gently informed is enough. Nothing about this discussion asks you to change who you are or how you live. There are no new rules to memorize and no comforts to give up. Continuing your life as it is, with confidence and routine, already supports your health. Prevention, in this sense, means allowing life to remain familiar. It means trusting thoughtful medical care and honoring your body's need for calm. By doing so, you protect not only your physical health, but also your dignity and peace of mind. When we place Nipah virus alongside other viral infections that can be asymptomatic, an important perspective begins to emerge. In medicine, silence does not automatically mean danger. Many viruses can exist in the body without causing immediate harm or disruption, especially when the immune system is quietly doing its work. Over the years, I have cared for many older adults who were surprised to learn that they had been exposed to viruses without ever feeling unwell. This is more common than most people realize. The body often manages these encounters calmly, without the dramatic signals we associate with illness. For seniors, this quieter response can actually be protective, allowing the body to preserve energy and maintain balance. Nipah virus belongs to a group of infections that are studied carefully because they do not always announce themselves early. This places it among other asymptomatic viral infections that doctors monitor thoughtfully rather than urgently. Monitoring does not mean something is wrong. It means medicine is attentive and prepared, while allowing daily life to continue undisturbed. It is easy to assume that if an infection is silent, it must be especially threatening. In reality, the opposite is often true. Severe infections usually disrupt the body quickly and clearly. When something remains quiet, it often reflects a stable interaction between the body and the virus at that moment. Doctors recognize this and respond with observation rather than alarm. For older adults, understanding this distinction is deeply reassuring. It removes the pressure to interpret every small change as a warning sign. It also reinforces the idea that health is not defined by constant vigilance, but by overall well-being and consistency. In dementia care, we are especially mindful of how fear can worsen confusion. Labeling something as dangerous simply because it is silent can create unnecessary distress. When information is framed calmly and accurately, the mind remains steadier. That steadiness supports memory, mood, and physical comfort. Placing Nipah virus within the broader context of asymptomatic infections helps normalize the conversation. It reminds us that medicine has long experience with quiet conditions and knows how to manage them responsibly. Silence in the body is not an emergency. It is often a sign that balance is being maintained. This understanding allows seniors to feel informed without feeling threatened. It reinforces trust in thoughtful medical care and protects emotional safety. When we recognize that silent does not mean dangerous, we give ourselves permission to stay calm, maintain our routines, and live with greater peace of mind. As we talk about silent infection, it is important to pause and look at the emotional side of health. In later life, emotional well-being is closely connected to physical stability. Long-term worry does not stay only in the mind. It gently but persistently affects memory, sleep, and heart health, often without being noticed right away. I have seen many older adults become more concerned about the worry itself than about any medical finding. When the mind stays on alert for too long, it becomes tired. Concentration feels harder. Words are easier to forget. Familiar tasks may take more effort. This does not mean something is wrong with the brain. It often means the brain has been carrying too much tension for too long. Memory works best when the mind feels safe. When worry is constant, attention is pulled in many directions at once. Thoughts repeat. The brain spends energy watching for problems instead of storing new information. In my experience, when reassurance replaces worry, memory often improves naturally, without any other change. Sleep is often the first routine to suffer. A worried mind struggles to settle at night. Thoughts circle quietly, even when the body is tired. Sleep becomes lighter and less restorative. Over time, this lack of deep rest affects mood, balance, and immune strength. Many seniors tell me they feel more tired during the day, not because of illness, but because their nights no longer provide true rest. The heart is also sensitive to emotional strain. Ongoing worry can increase heart rate and blood pressure, creating extra work for a system that prefers steady rhythms. When the nervous system remains activated, the heart does not get the calm signals it needs to recover fully. This is why emotional calm is not a luxury in older age. It is a form of protection. In dementia care, we are especially aware of how emotional stress can worsen confusion. Anxiety can make memory changes appear more severe than they truly are. When fear is reduced, clarity often returns. The same principle applies to all seniors. Emotional safety allows the brain to function more smoothly. Understanding health information in a calm way helps protect emotional balance. When topics like silent infection are explained without urgency, the nervous system relaxes. Breathing slows, muscles soften. The body returns to a more natural state of balance. Long-term worry does not add protection. It quietly takes it away. Choosing calm understanding supports memory, improves sleep, and eases strain on the heart. For older adults, this gentle approach honors both health and dignity, allowing life to continue with greater comfort, confidence, and peace. As we come to the end of this deeper explanation, I want to gently reinforce something that has guided medicine for generations. Science works best when it is allowed to move without fear or pressure. Careful science is not slow because it is uncertain. It is deliberate because it understands responsibility. In my many years of caring for older adults, I have learned that rushing rarely leads to better outcomes. Whether we are adjusting a medication, responding to a new diagnosis, or simply helping someone feel safe during a difficult moment, patience creates better results. The same principle applies to medical research and public health decisions. When science is pushed by urgency or fear, important details can be missed. When it is guided by care, outcomes are more stable and trustworthy. Older bodies respond best to this kind of thoughtful approach. Aging systems value balance. Sudden changes, loud warnings, or constant pressure can disrupt that balance. Careful science respects the rhythms of the human body and allows knowledge to develop in a way that protects both physical and emotional well-being. Trusting medicine does not mean ignoring questions or concerns. It means understanding that many professionals are quietly working with diligence and experience. Researchers, doctors, and healthcare teams observe patterns over time, confirm findings, and choose actions that minimize harm. This work often happens without headlines, but it is no less meaningful. For seniors, this trust offers relief. It means you are not expected to react urgently or live in a state of alert. It means decisions are being made with long-term health in mind, including the needs of aging bodies and minds. This allows you to continue living your life with routine and confidence. I often remind my patients that fear demands immediate answers, but wisdom allows time. Medicine is rooted in that wisdom. When we allow science to work at its natural pace, it produces results that last. Those results are safer, more reliable, and more respectful of human dignity. Reinforcing trust in medicine is not about blind faith. It is about recognizing the value of careful work. When fear is removed from the process, clarity emerges. When pressure is reduced, understanding grows. This is how science serves us best, and how it protects the well-being of older adults with patience, steadiness, and care. As we gently come to the close of this conversation, I want to thank you for staying with me and for listening with such care. Choosing to understand your health in a calm and thoughtful way is a quiet act of strength. Learning about silent infection does not mean that something is wrong or that your daily life needs to change. It simply means you chose clarity over uncertainty. I hope this time together reminded you of something important. Your body has carried you through many years with wisdom and resilience. Even when it speaks softly, it is still working on your behalf. There is no need to watch it closely or live with worry. Trusting your body and honoring its steady rhythm allows it to do what it does best. Patience with the mind is just as important. When information arrives gently, the brain feels safe. When the brain feels safe, sleep comes more easily, memory feels steadier, and the heart finds a calmer pace. Knowledge should never feel heavy. It should feel like reassurance that settles you back into your routine. Thoughtful medical care works quietly alongside you. Doctors and healthcare teams are trained to observe carefully and act responsibly without urgency. You are not expected to carry that responsibility yourself. Your role is to live your life, keep what feels familiar, and allow trust to replace tension. If there are moments when health information feels overwhelming, I invite you to return here. Senior Health Daily is meant to be a calm place to pause, listen, and feel supported. Thank you for sharing this time with me. Take a gentle breath, return to your day, and carry forward the peace that comes from understanding. I look forward to being here with you again whenever you need a steady voice and a reassuring presence.